Welcome to CardioCast for Friday, October 4th. I'm Dr. Jim Dwyer. This week, the TWILIGHT study affirms shorter dual-antiplatelet therapy after PCI. Red meat gets a surprising boost from new guidelines. And preeclampsia sometimes lingers into a fourth trimester. But first, all lifestyle-related cardiovascular risk factors are not equal when it comes to secondary prevention after a first acute myocardial infarction. Blood pressure, blood glucose, obesity, and LDL cholesterol may seem easy choices to assess risk. But those usual risk factor suspects for all-cause mortality, major adverse cardiovascular events, and other adverse outcomes may not be the most dangerous ones. Dr. Emil Hagström of Uppsala University in Sweden presented the results of a massive registry study at the annual Congress of the European Society of Cardiology. The study's authors examined the long-term relative importance of controlling 6 major lifestyle risk factors for secondary cardiovascular prevention. 2 risk factors that physicians often emphasize in patients with known coronary artery disease, an elevated LDL cholesterol and obesity, barely moved the needle. Those 2 factors consistently showed the weakest link with long-term risk of adverse outcomes. Hypertension and elevated blood glucose occupied the middle ground in terms of predictive strength. That left insufficient physical activity and current smoking as the strongest risk factors for poor postMI outcomes. Insufficient physical activity was defined as not engaging in at least 30 minutes of moderate intensity exercise on at least 5 days per week. PostMI patients with none of the 6 risk factors had the same risks of all-cause mortality, cardiovascular mortality, and stroke as matched controls with no MI history. Those with 1 risk factor not at target had 41% greater risk compared with controls. And patients with more than 4 of the 6 risk factors not at target had a 409% greater risk of all-cause mortality than controls who had never had a heart attack. Given the findings, Dr. Eva Prescott of Copenhagen University comments, the conclusion is that lifestyle remains at the core of prevention of cardiovascular events. A study reported this week supports the trend for shorter dual antiplatelet therapy after stenting in high-risk patients. Dr. Roxana Moran presented the 7,000-patient TWILIGHT trial results at the Transcatheter Cardiovascular Therapeutics meeting in San Francisco. They showed that after 3 months of Ticagrelor plus aspirin following percutaneous coronary intervention, stopping the aspirin but continuing the Ticagrelor resulted in less bleeding with no increase in ischemic events. Dr. Moran of Mount Sinai in New York said that this was a superior therapy to staying on both drugs, which is the more usual approach. Patients in TWILIGHT all took 90 milligrams of Ticagrelor twice daily and low-dose aspirin for 3 months. After that, they were randomized to continued treatment or Ticagrelor plus an aspirin or placebo for a year. At that point, 4% in the Ticagrelor monotherapy group versus 7.1% in the Ticagrelor plus aspirin arm developed a serious bleeding event, a significant difference. And there was no difference in death, myocardial infarction, or stroke, which occurred in 3.9% of each treatment group. Dr. Moran said that, although it can't be said for all comers, for patients whose physician felt comfortable putting them on aspirin and Ticagrelor, who tolerated it well for the first 3 months, and who had no clinical and angiographic indications of risk, aspirin can be peeled away. People who eat red meat or processed meat should continue their current meat consumption. That's the surprising message from guidelines by an international panel that analyzed the health effects of red meat and processed meat consumption in systematic reviews and meta-analyses. The guidelines appear in the Annals of Internal Medicine. The panel found low to very low certainty evidence that diets lower in unprocessed red meat may have little or no effect on the risk for major cardiometabolic outcomes and cancer mortality and incidence. What's more, meta-analysis results from 23 cohort studies provided low to very low certainty evidence that decreasing unprocessed red meat intake may result in a very small reduction in the risk for major cardiovascular outcomes and type 2 diabetes. And there were no significant differences in all-cause mortality and cardiovascular mortality. Dr. Alice H. Lichtenstein, a nutrition expert at Tufts University in Boston, notes that the research results regarding heart disease were based on a single study of older women counseled to reduce their total fat intake and increase their fruit, vegetable, and grain intake. That makes drawing conclusions about red and processed meats questionable, she said. Furthermore, the evidence for replacing saturated fat intake with unsaturated fats is strong. Speaking for the American Heart Association, Dr. Lichtenstein said the group continues to recommend that adults should eat an overall healthy eating pattern, full of vegetables, fruits, nuts, legumes, whole grains, lean protein, and fish, limiting foods high in saturated fat and dietary cholesterol, and minimizing trans fats, sodium, processed meats, refined carbohydrates, and sweetened beverages. She said the overall picture is key, not just one food or food group. We'll be right back after this message. A large portion of maternal pregnancy-related deaths happen in the days or weeks after the baby is delivered, and they're often related to hypertension. Think of it as preeclampsia's fourth trimester, and know that it can be a dangerous time for new moms. Dr. Natalie Bello is a cardiologist and assistant professor of medicine at Columbia University in New York. Speaking at the Joint Hypertension 2019 meeting, she said doctors have been taught that delivering the placenta meant the preeclampsia would go away. But Dr. Bello warns that's not the case. Postpartum preeclampsia is real. Headache and visual changes in association with hypertension after delivery should raise your suspicions. Women can progress rapidly to eclampsia and HELP syndrome. Dr. Bello says, unfortunately, sometimes doctors don't recognize what's going on because they don't know women have recently given birth. In the face of such symptoms, always ask women if they've delivered recently. Dr. Bello explains that hypertension should resolve within 6 weeks of delivery and blood pressure should be back to baseline by 3 months. To make sure that happens, check blood pressure within a few days of birth and regularly thereafter. You can find these stories and more by visiting www.mdedge.com/cardiology or by clicking the links in the podcast notes. This week's contributors include Jeff Craven, Bruce Jansen, and Alex Otto, and CardioCast Cardiology News and MDedge Cardiology are edited by Catherine Hackett. Remember, you can find CardioCast via Amazon Alexa, Apple Podcasts, Pandora, or wherever you listen to podcasts. And if you like what you hear, please leave us a rating or review. For MDedge, I'm Dr. Jim Dwyer.